Hey everyone, this side Rohit Pandey, CPC certified medical coder. So today, one more thing, I just want to tell you that those who are visiting my channel for the first time, kindly share and subscribe my channel. And the thing is, I already taught you, integumentary system. You can go and watch that video as well. I'm just continuing a series of anatomical part. I already completed integumentary, and now today I'm going to start musculoskeleton. So I'm going to share my, uh, you know, yes, my. Yes, I hope now you can see this. Okay. Okay. Welcome to the Malij Talk. This side Rohit Pandey, CPC certified. I already mentioned that. You can see this picture. Ta-da, ta-da! We are going to learn today musculoskeletal system. Here you can see a skeleton, then muscle. And when we add muscle and skeleton, then it becomes musculoskeleton. Okay. Now, function of musculoskeletal system, it helps protect stability and size the body. Okay, it helps protection, stability. With this skeleton, if if we have muscle, then we can just be like a rubber. Okay, so when there is skeleton and after that a layer of the muscles, so it be like make stability and size of the body, then allow the movement of the body. Muscles give movement to our body, ligaments and these of things make movement of the body. It helps in the production of the blood cells and storage of minerals. The musculoskeletal system is composed of two systems. One is two systems. Okay, obviously muscles plus a skeletal system, then composed of two system, then it will call like musculoskeleton. Muscular system and skeletal system, I already mentioned. It consists of soft tissues, like soft tissues are like muscles, tendon, ligaments, and hard tissues are like bone. Okay, it is I mean important point. It consists of soft tissue. Soft tissues are like muscles, tendon, and ligament, and hard tissues are like bones. Okay, and then muscles are the largest soft tissues of the muscular system. Muscles are the largest soft tissues of the muscular system, and then produce contractions that move body part include internal organs. In humans, we have 650 plus muscles and how many bones? Anyone can tell me? 206 bones normal human have. Okay, so write in comment about how many bones a neonatal or a baby have. Okay, you just mention that thing in comment section. Muscles can be divided into the following three types. What types are? Smooth muscles located in the esophagus, okay, stomach, small intestine, urethra, bladder, urethra. Cardiac muscle. Cardiac means you understand that cardiac means heart, related to heart muscle. They are talking about heart muscle. So located in pericardium. Yeah, overall, I mean, just it's around whole heart, pericardium. Okay, endocardium inside the heart, and myocardium, muscles of the heart. Skeleton muscles, apart from smooth and cardiac muscles, okay, I mean, except smooth muscles and cardiac muscles, all the muscles which left, it comes under skeleton muscle. Apart from smooth and cardiac muscle are smooth muscles. Okay. Skeletal system. Firstly, we just gonna read skeletal system. So you can see over there that there are bones that make up the skeleton is divided into two classification. It is very necessary. I already, today we just do uh what we did. I'm already made a video where a question came related to appendicular skeleton system. So here is the explanation. The bones that make up skeleton is divided into two classification. One is axial and another one is appendicular. Okay. The axial system consists of the skull bone, frontal, temporal, parietal bone, which protects the brain and support the facial structure. The skull bone, frontal, temporal is related to temple, parietal lobe, which protect the brain and support the facial structure. Skull, in our skull bone, there is a brain, brain and our facial structure, all are just saved by this temporal, frontal, parietal bone, facial bone, lacrimal near the eye. You know that lacrimal is used for tears, so lacrimal gland, tear comes out of the lacrimal gland, responsible. A lacrimal near to eye, saphonoid, nasal, nose, vomer, uh, upper of the lips. Okay, zygomatic, it's like cheekbone. Okay, mandible and maxilla. Okay, jaw, it related to jaw, and ear bones, malleus, incus and stapes. Here you can relate it axial as axial skeleton. So there is skull. Okay, that is what spine, ribs, rib cage. Okay, and that sacral, and it is all come under spine. Okay, cervical to coccyx, sacrum, and this is ribs. These bones come under axial skeleton, and in appendicular, uh, it is like limbs, both limbs. Okay, and that pelvic part. Okay, let's see next. Vertebral column, which surrounds and protect the spinal cord, it is also comes under axial. Here we can, let me, okay. Okay, here I already mentioned that axial skeleton, that spinal part. Okay, so here, that vertebral column which surrounds and protect the spinal cord. Okay, here you can see that in a spine, that is spine, where spinal cord comes, just covered by this, surrounded by this, and protect the spinal cord and support the head. Okay, next, thoracic, rib cage. Here you can see rib cage. Okay, rib cage, thoracic, which surrounds and protect the organs within the chest, including heart and lungs. You can see heart and lungs comes under this, and it surrounded and help to protect the heart and lungs. The appendicular skeleton consists of, that is the appendicular skeleton, that limbs. Okay, that pelvic part. Okay, let's check out pectoral girdle, that shoulder part, that behind that rib cage, there is pectoral girdle, shoulder. Okay, next one, pelvic bone, that is pelvic bone. Okay, ischium, ilium, ischium and pubis. During puberty, they fuse. they when we are like teen in I think in teenage, or we are like when we are baby or in neonatal phase. Ischium, ilium, and pubis, I think they are I mean apart from each other, and during puberty, when we just achieve our puberty, they fuse together to form a single bone. Okay. Next one is upper and lower limb. Limbs and extremities are related to hand and legs. We usually upper limbs like hand, and lower limb is we indicate for legs. And similarly, extremities like upper extremities is related to hand, and lower extremities related to legs. Okay, so here you can see that upper and lower limbs, arms and leg. Femur is like that thigh bone. Tibia, tarsals, metatarsals, and flanges, these fingers, toe fingers, and that hand fingers. Okay. Next, bones. They provide support and shape of the body. I already mentioned when I talk about muscles. Okay. Here you can see. Let me. Okay. That portion, deltoid tuberosity, that is head of the bone. Okay. That is anatomical neck. Here you can see that part. Okay. And that is lesser tubercle. That portion is greater tubercle. Intertubercular sulcus. And actually I'm talking about that humerus, left anterior view. You can see this is like bone. Okay, this is bone. And because of this, our body gets support and shape. It provides shape and support. Okay. Bones are classified into 5 types. Let us that is long. That is long bone. Okay. That is short bone, short in size. Irregular, I mean there is not, I mean it having shape, okay, but it does not have shape. Okay, you can see this irregularities. Okay. And that is flat. This portion is flat. Okay, this portion is flat. This, so that is flat bone. Irregular bone, you can see there is no irregularities. This is short bone, and this is long bone. Okay, you can see long bone. Okay, this is type of bones. Okay. Long bone is like femur, thigh bone. You can see over there. Let me. Okay, you can see this is thigh bone. We call it femur. Here you can see, like here you can easily relate. This is our long bone, and this is like femur, longest bone in the body. Short bone is like, these are such like cube, such as bones in the wrist and ankle. You can see here. Oh. Here you can see. Okay. Okay. Here you can see these are cubes like shaped. Okay. Cube like shape, such as bones in the wrist. This is wrist portion. Okay. That are flanges, and these are like wrist with cubic form, and similarly in ankles as well. Okay. And now flat bones. These are plate-like, such as bones in skull. You can see flat bone, uh, that is flat. When you break it, you can realize that there is no irregularity in. Okay, they are totally flat in shape. Okay, now irregular bones, these have complicated bones such as pelvic bone, vertebra, okay, vertebrae, and some facial bones. Let me check. Like this is facial bone, maxilla, mandible, and zygomatic, and that temporal. So these are irregular. Okay, and these are face bone, and these are irregular bones. Similarly, that is vertebrae. Okay, where spinal cord, they protect spinal cord. Okay, and that is pelvic bone, and you can see the irregularity in this. Now sesamoid bone, another type. These are unique type of bones that form with tendons. Okay, within tendons, and they are small and round, vary in size and number. Example in kneecap and or patella. Let's see kneecap. Here you can see that is kneecap. Okay, or we can see, we can say it is patella. Okay, here you can see original. I mean, it is like in cartoon form, and it is like original form. Here you can see patella, or we call it kneecap. Okay, so it is like a sesamoid bone. Okay, another one, tendon. Tendon, dense fibrous connective tissue that connects muscle to bone, that is called tendon, which connect between the fibrous connective tissue, which connect between the muscles and bone, that is called tendon. Okay, we have, if we have a ligament, then I'll show pictures as well. Let me finish it first. A ligament is fibrous connective tissue that connects muscles, bone, and connective tissue between the muscle and bone, which connect muscles and bone, that is called tendon. Okay, ligament is like bone, okay, both side, and a fibrous connective tissue which connect between the bone and bone, that is called ligament. Bone and two other bone, and it is also known as articular ligaments. Okay, a ligament is the fibrous connective tissue that connects bone to another bone. Okay, other bone. It also known as articular ligament. Here you can see muscle and bone. Now you can tell me, this is bone, this is muscle, and that is called tendon. You know, which connect muscles and bone together. Okay, that is called bony attachment. Okay, that is tendon, that is muscles, bones, and that connection, that is called tendon. Let's check, and you can see over there that this is tendon, which connect that patella part, and muscles, that is called tendon. And now this is bone, that patella, and that part. Okay, below the knee there is a bone. Okay, which connect with patella, and that is called ligament. When muscles connect with the bone with help of ligaments. Okay, we easily can understand with the pictures play a very much important role in medical coding as well. I already told you, whenever you do chart, whenever you read chart and you got anything which I mean you are not aware with that word or that terminology, just go and google it and then find, try to just see the pictures as well. It will make a image in your mind, and it will definitely help you. Joint are formed where two or more bones meet. Okay, they just promote movement of the body parts. Our movement is not necessary attribute of joint, as some joint do not move. Example, joints between bones of skull. these are not move, I can show you. Okay, type of joints. Okay, here you can see ball and socket, hinge. That ball and socket happen between that part. Okay, you can see shoulder part, where here you in neck it is like movement like pivot. Okay, you move here and there, and then that is wrist and hand part. Okay, that is ellipsoidal, and that is hip, and knee part is joint structure, hinge part, you can see over there. So joints are formed where two or more bones meet. They promote movement of body parts. However, movement is not necessary attribute of joint, as some joints do not move, like bone of skull, and that is suture like structure. It is like joint, but there is no movement between that. You know, you easily can understand with pictures. Now we come under I mean it, these words are so much important, so you have to know about it, word root and that their meaning. Ortho means joint. Okay, osteo means bone, femoro means femur. Okay, sacro means sacrum, and osteum means bone. Osteo and osteum, we can write in that way, bone. Okay, we again repeat that. Ortho means joint. Osteo, here you can see osteo, and here you can see osteum. Both have same meaning, bone. Osteo and osteum both have same meaning, bone. Okay, femro, femur, sacro, sacrum. Okay, pathology, disease related to musculoskeletal system. Let's check out myalgia. Myalgia means muscle pain, algia means pain, and myo means muscle pain, that is called myalgia. Arthritis, artho, you already see over there that artho means joint, and itis means inflammation. When they both are connected make arthritis, and which meaning is like inflammation of joint. Okay, osteo means bone. Osteum bones. Porosis, softness of bone, and disease in which bones become weaker. Porosis means softness. Okay, softness. So like disease in which bones become soft or weak. Okay, carpal tunnel syndrome, a numbness and tingling in the hand and arm caused by a nerve in the wrist. Okay, that is called carpal tunnel syndrome. It happens because nerve in the wrist got damage, or maybe it struck between the bones, like happen like this. Okay, and that numbness and tingling in the hand and arm caused by nerves in the wrist. Okay, and last but not the least, muscular dystrophy. Muscular dystrophy is a group of disease in which the muscles that control movement will become weak. Okay, uh, weak. Okay, and now let me. Okay, so I'm gonna find out carpal tunnel syndrome thing in Google, so you can easily, I mean, learn about it. Okay, so here we can type. Okay, here you can see carpal. Okay, that thing. Carpal tunnel syndrome is caused by pressure on the median nerve. The carpal tunnel is a narrow passageway surrounded by bones and ligament on the palm side of the hand. When the median nerve is compressed, yeah, that word which I used for struck, or which that is compressed. Symptom can include numbness, I already told you, tingling and weakness in the hand. Okay, let me check out images as well. I already told you it is necessary to just watch out that thing. So Here you can see that there are a lot of nerves going through a small tunnel. Okay, when it got what is that exactly, compressed. When it compressed because of multiple reasons, so it be like paining. Okay, and feel like numbness, and these kind of symptoms happens, numbness and parathesis. Here you can see this, you can see it is like tunnel where these nerves passes. Okay, because of some issues like compressed median nerve, that nerve which is got compressed, then symptom like numbness. Okay, numbness, tingling and weakness happened. Okay, muscle dystrophy, just look that also. Muscle dystrophy. What is muscle dystrophy? Muscle dystrophy refers to a group of more than 30 genetic disease that cause progressive weakness and degeneration of skeletal muscle used during voluntary movement. These disorder vary in age of the age of onset, severity, and pattern of affective muscles. Here you can see, okay, Dutch Hine, DMD, Banker, Beckner, or Becker, okay, limb girdle. These are like muscle dystrophy. What is the different type of muscle dystrophy? Here you can see that, uh, okay, Dutch Hine, DMD, okay, Becker, limb girdle. Okay, the most common type begin between 2 and 3, affect lower limb first. Okay, you can see there, and impact heart and respiratory muscles later on. Okay, appears between 5 to 15. Okay, has slower progress than DMD, affect hip and pelvic area first, cause muscle weakness in the heart for the most. Limb girdle, over 30 forms, start in either adulthood or childhood, create muscle weakness and atrophy in hips and shoulder. LGMD progression is dependent on the age on of onset. Okay, that is enough. We don't want to, you know, go in more explanation or bigger way. Now, if you like that video, then you can subscribe my channel. And the thing is, I'm going uh, I'm in future I'm making more videos, and it is like series for anatomy, all the body part, all the organs. I will, I will cover all digestive system, endocrine, exocrine, urinary, okay, reproduction, all will, I will teach you all the things. Okay, so don't worry and just try to if you're serious and you're you are reading these things, then you must take a copy and pen with you or make notes as well. It will definitely help you in your CPC exam, for your CPC exam. Okay, good luck and bye. And at last, I'm saying that please subscribe my channel. Okay, I just want to make this YouTube channel, my YouTube, this platform, I mean yours platform, in very classy manner, where every medical student take help from this. Okay, and the last thing that we started our coaching as well for the CPC and for the ENM and ED, those who want to change their specialty from radiology, pathology, and anything. I mean, they just want to change to that, to ENM or ED specialty. You can come over us, just give us chance and we will definitely give our 100% to you. Okay, you will definitely get I mean, you will see the change between, I mean, in you in yourself. Okay, so, and we are totally our teacher and our team is doing hard work to make everything easy for you. Okay, and if you are from I mean, you are, if you're a student of humanities and if you have commerce, then you will definitely come to us. We will definitely make everything easy, and we have PDFs, we have ICDs, we have 50 ICDs which usually come under charts, okay, we did in our offices. So it will definitely help you. Okay, so come to us, we'll definitely make your future bright, and we'll help to make your future bright. Okay, so with that, I hope everything will be good in your life.